New York City bore the brunt of this last spring when we were first being hit hard in this country. You've just heard the news about a record number of travelers, a record number of air travelers in this country yesterday. What are you bracing for in New York City in the month of January?
It's not just New York City, it's the entire country. We are seeing, like specifically in LA, there are no hospital beds. There are no ICU beds. They are talking about crisis level care when it comes to not just triage, but admission to the hospital. Patients don't know how to get these monoclonal antibodies. And everybody who is traveling is not just risking bringing the infection from their home to their vacation destination, but catching the virus at vacation and bringing it back to their home, which is really dangerous with all of these new strains of the virus as well. So it's not just scary to those of us on the front lines. It's also very disappointing that people have just given up on containing this virus.
We saw a December surge after Thanksgiving travel. Are you expecting to see a January surge after the travel statistics we just reported?
Absolutely. There's nothing stopping the spread of this virus. People have just given up. They're not just traveling state to state or across countries, but they're also having numerous parties, over Thanksgiving, Christmas, and now New Year's. So we do expect a continued increase in the number of cases of this virus. And no matter how many people we vaccinate, it means nothing if the virus continues to spread exponentially in our communities.
Let's listen to what Dr. Fauci said about the vaccine this weekend.
Measles is about 98% effective vaccine. The COVID-19 vaccine is about 94, 95%. Measles is the most transmissible infection you can imagine. So I would imagine that you would need something a little bit less than the 90%. That's where I got to the 85. But I think we all have to be honest and humble. Nobody really knows for sure, but I think 70 to 85% for herd immunity for COVID-19 is a reasonable estimate.
Dr. Kass, with the delay now in the distribution of the vaccine, we're seeing a much slower distribution than was promised by the Trump administration. What are you anticipating as the timetable for getting to that herd immunity?
Look, it's completely unknown. The distribution of the vaccine has been slower than we expected and actually very frustrating because once the vaccine is delivered to the states, it's up to local medical centers and private offices to start distributing the vaccine at the state's recommendations. And as we go to scale outside of fixed facilities, we're going to see a lot more distribution inequity when it comes to who's going to get vaccinated, when, and how. And that's just going to be very, very complicated. I don't expect us to get to any reasonable mass vaccination until the third quarter, I would say, of 2021, which means that we're looking through the rest of the winter and the spring, really continuing to wear masks, be distanced, and stay basically away from other people that aren't in our nuclear families.